Welcome to Health Tech Hustle. We exist to share stories of the brave entrepreneurs helping to solve the most important problems in digital health today. We interview top leaders in health tech and bring them onto our show each week to listen and learn from their story. With your host, Rodney Hu, founder of 209 Digital.
Hello and welcome to today's episode of the Health Tech Hustle podcast. I'm joined with Mr. Bill Reisacher. He is a senior scientific advisor for Intramural Therapeutics and Allovate Therapeutics. He's also an associate professor at Weill Cornell Medical College and the medical director and co-founder at NovoPlexus. And also, after doing some research, found out he's also has some experience in stand-up comedy as well. So, with that said, welcome to the podcast, Bill.
Thank you, Rodney. Thanks for having me on. It's a pleasure to be here.
So, let's kind of just jump right into it. Why don't you just give everybody a brief background about what you do and how you got into where you're at?
It sounds good. I've been, as you mentioned, I've been working at Weill Cornell as an ear, nose, and throat doctor for quite a while now. I've been in the medical field for 25 years, and I've also been very active in the entrepreneurial space for about 10 of those years. And I got really interested in health tech because I've been seeing all the problems that the healthcare industry has been having. I love the industry, but we're way behind the times. I'm still using fax machines, snail mail, phone calls. I mean, it's crazy, but I love seeing patients. I'm seeing them one at a time. But what I really want to do is to help people on a larger scale. What I really want to do is I want to leave this industry a better one, in better shape than when I found it.
Okay, nice. So I see that you are the founder of NovoPlexus. So can you kind of give us a background of that company and what you're doing in that space?
Yeah, it sounds good. The NovaPlexus, I started with my co-founder in 2018. It's kind of an interesting story. My co-founder and I, we met in the comedy club. We're actually doing stand-up comedy together there. And we had a really good relationship. We riffed off each other, bounced jokes off each other. So I actually started consulting for one of his other companies. And then we were talking about the future of healthcare over many beers on the Upper East Side at a place called the Pony Bar. And NovaPlexus came right out of that. And it's a good team. I have the medical knowledge. He's an expert on the business and tech side. So we had the complementary skills. And throughout discussions, we realized that it was obvious something needed to be done in healthcare. And we were the perfect people to do it. We could move quickly. And we had that scrappy attitude that led us to believe that we could actually pull this thing off.
Nice. So you provide the medical expertise and he's on the business side and kind of pairing that together to solve a problem within the healthcare industry. So
exactly.
What exactly does NovoPlexus solve? Like what problems in healthcare do you guys help solve?
Yeah. So when we first started out, our vision was to create an ecosystem where companies who had the best solutions to all the problems in healthcare could actually plug in and share information in real time. As we know, healthcare spending is out of control. It's not sustainable. And these are the problems that we were faced with. In 5 years, healthcare spending is going to be about a quarter of our gross domestic product. So we also realized that the balance of decision-making was all wrong. It's in the hands of a large few payers in the healthcare system, in the hospitals. Patients, like you and me, we have no power in this entire system. We have no idea how much we're going to pay for services. There's a lot of sticker shock, as you know, when reading the explanation of benefits. And so we said, hey, let's create a community where we can know what we're going to be on the hook for financially before these services take place. And so that's where we really started this project. We wanted to be in charge of our own spending. So price transparency was definitely our target.
So price transparency.
Yeah.
Okay.
And
so you guys have been working together for about 2 years. So how long did it take between like the time you guys first met each other and started brainstorming the idea before you actually got this platform, this marketplace up and ready for the public to use?
So we actually moved pretty quickly. We had the vision for the idea, and we worked with some real experts in terms of programming, and we put together a good team. we did encounter some obstacles along the way, and this is where we really learned along our journey. When we started, we wanted to create that ecosystem, as I mentioned before, and we still have that goal. NovoPlexus means new network, and that's what we really have in mind. But we realized quickly in 2018, when we went out and started pitching this idea to other people, that trying to be too many things to too many people can sometimes be very confusing, both the customers and investors. And so that's why we really pivoted and focused our idea on price transparency. Also, in 2018, 2019, we saw blockchain was sort of becoming a very overused, misunderstood concept. It was getting some actual negative backlash in the press. Because our ecosystem uses a blockchain architecture, we also had to be very careful when talking to investors. For example, they would say, "Okay, pitch your idea to us, but don't use the word blockchain because we don't want to hear it anymore." So these were some of the obstacles we had moving into 2018. So in 2019 was really when that pivot occurred, where we realized we had to focus in our idea and really pick what was most important and most doable at this moment.
Okay, interesting. So I hear you talk about like putting together a team to help get this project and get your company up and running and out to the public. So can you kind of describe the process of how you're able to go about finding experts and people to help you create this vision that you guys thought of?
Well, fortunately, my partner, his wife, is a genius in the computer science industry. So it helps to have people in your circle who can help you. But we found people through our networks. It seems like they all congregated on the Upper East Side. That seems to be a job requirement for our company, that you had to be living on the Upper East Side. So we launched our small revolution from this area. But it was really all about the network and just pulling people together and talking to people. We didn't create a tremendously large team. We tried to keep ourselves extremely lean. The money that we did raise, we put to really good use, not building out large teams as a lot of the companies were doing at the time. They were getting very large investments without a whole lot of platform to show for it. So we did it the exact opposite way. We raised less money, but we created a very lean, robust team, and we got a minimal viable product together within about 6 months.
Oh, wow, nice. So like you mentioned that your experience is in healthcare as a doctor, but you've partnered with a businessman to help kind of bring this NovoPlexus to life. But have you ever had any other prior experiences as an entrepreneur, starting something from the ground and building it and growing it yourself?
Yeah, I have had some experience doing that. I've been in the entrepreneurial space for about 10 years. So I've played a role in launching a few other companies in the biopharmaceutical and the biotechnology space. So I did have some of the business knowledge, but what's really important is knowing what you can do and what you can't do. So having those complementary skills is really helpful. So my partner, he's done a lot in terms of business development in prior jobs and prior careers. So he was definitely the ideal partner for me. He also had a lot of the experience in the tech space, which while I can check my emails, I still ask my kids for help for some of the tech. So I'm not going to portray myself as the tech guru in this space, but hey, I'm learning.
Nice. Your basic knowledge is all you need to start, right?
I know a lot more than a lot of my doctor peers, so I feel like I've kind of bridged a major chasm between the physician, the medical community, and the tech world. I feel like I have maybe a foot in both of them, and I'm kind of forming a little bit of a bridge.
Nice. So you're just constantly learning, constantly growing.
Yeah, that's
Nice.
important.
So who would be like the ideal people to be a part of the NovoPlexus community? How can they contribute?
Well, the people who are going to really going to be using this platform are people who are going to want to know price transparency. They're going to want to take charge of their spending and also comfortable letting technology help with that. And also people who are willing to build to play an active role in building this community of wise shoppers. The way we've designed this platform is using a lot of novel strategies and tactics, using gamification, using machine learning. So it does take a user to be at least comfortable with using some of these modern technologies to help with it. As our platform grows, even larger entities like hospital systems and payers could gain value from the information we provide. I can tell you just a little bit about the platform. Basically, it's using real world data to make pricing known to a wide audience. We had some very fortunate regulatory changes this year. Now hospitals and offices have to publish their charge master, which is actually what they charge for services on their website, but they didn't have to make it easy to find. So if you go to their websites, you can't find this information. So what our app actually is, and our platform is a web crawler that can literally extract all of that information on pricing. Plus we use the gamification. So we're asking users to take a picture of their EOBs, their explanation of benefits, and we're able to parse out the information that we need, like cost, location, doctor, procedure, while keeping all their personal information safe. So you can get a really accurate range of what you're going to pay for a service just plugging in the information before you actually have that service. So when you're in the doctor's office contemplating getting that endoscopy or whatever the doctor's recommending, you could plug that right into the app and you get the results instantly.
Oh, okay. That sounds very convenient, actually. And this is data that you don't have to pay for. You're just crawling the web for data that's already out there, right?
Yeah, this data is already available. It's just really hard for a user to get. And of course, if you wanted to get it from multiple sites, that would take you, a lifetime to do that. So this is able to really just extract all of the information that's out there on the web right now. That's publicly available, and it puts it into an easy to read format and gives you kind of a range of what you're going to have to pay. And again, when you combine the real world data from people right in your community who are adding in their information, it gives you a really nice tight range of what probably you're going to have to pay out of pocket. And none of us know how much we're going to have to pay out of pocket for any procedure. We find out, we sometimes don't even know at the end of the year what we've paid for healthcare.
Oh, okay. So going back to your audience, how are you actually going about bringing awareness to the NovoPlexus platform, and how are you reaching your target audience?
Well, right now we have the app, the price transparency app is in development. We're hoping this year, one of our major goals is to actually finish developing it. We're finishing up a seed round of financing, and we're hoping by the end of the year to get the app into beta testing. And it's going to be, put out there on social media. We're hoping it has a little bit of viral spread once people kind of hear about it. But we're really going to the people first. We're really getting people involved by just obviously giving this out to them and seeing how they like it, having them test it out and tell their friends about it. And we think once this kind of catches on, a lot of people are going to really find the value. It's not only going to provide them, we think, mind-blowing information, it's also going to be a lot of fun to use.
Nice. So you're giving like a beta version in a sense to people so that they can use it, and then you're just improving your product and your service based on the feedback that they're giving you.
Exactly. It's going to be, hopefully it's going to be a very quick, a quick cycle. So we're going to beta test it and then get our feedback quickly, and try to iterate quickly on it and try to get, just better and better versions out there. Just go through a quick cycle of iteration.
Nice. So it sounds like you understand the grand game plan and where you guys are now and where you want to get to. And you guys have been making a lot of progress, but I know that the whole entrepreneurship, growing a business, growing a company isn't the easiest thing. So what kind of obstacles and challenges have you guys faced in your journey to actually getting this thing up and running, and just any kind of obstacles that have gotten in your way so far?
Yeah, I think definitely our original pivot from doing that large network to sort of honing down the idea. I think that was one of our biggest obstacles. When do you actually make that pivot, and when do you realize that what you're doing is not, it's not, going as fast as you want and where you want to go. But now we think we're on the right track, and we've gotten a lot of good feedback. Right now, our app doesn't require a blockchain architecture. It's an app that uses a web crawler essentially, and some other technology that's out there, almost like apps like Waze, where you put in information, the users put in information, and that helps the whole community. So that's kind of what we based that on. But that was the biggest challenge we had, was knowing when that point was that we had to pivot, and we had to do something differently. Yeah.
Interesting. So sounds like an awesome platform. I'm excited to see where you guys are going with that and the improvements that you guys make in the future. So that's more on the entrepreneurship side. And I kind of want to pivot to talk about your background in healthcare as well. Now that you're an associate, because you're an associate professor at the Weill Cornell Medical College, can you kind of give us a background on what you're doing over there?
Yeah, so I'm an ear, nose, and throat surgeon, as I've been for 25 years. So that's a passion that I have. I love seeing patients. I love the quality of life aspect of that. So, and I also love the teaching aspect of that. So I teach medical students, I teach residents, medicine and surgery. So it's a real honor for me to be in the education field, educating the doctors of tomorrow. And like I said, that's an industry that I really love, and I want to see the industry do well. And that's why, I want to just do things on a larger scale to help that industry.
Nice. So you're still active in the community and in the industry where you started, but now you're just trying to branch off because you've identified and you noticed the problem and you're trying to create a way to solve that problem.
Exactly. Yeah, I'm in the perfect position really to see all of these problems. Like I said, I've seen all the efficiencies in healthcare, and I've been on the front lines, so I see the problems that healthcare has, and that's why I have that unique perspective to see what the solution could be.
Nice. So you're essentially having two different careers, as an entrepreneur and as a healthcare professional. How are you bridging that gap and managing two careers essentially at the same time?
Well, it definitely takes a lot of energy. It takes a lot of organizational skills, and using your free time in the evenings and weekends to really to work on the other projects. Obviously, my job as a physician takes up a tremendous amount of my time. So it's really about time management and knowing not to overextend yourself. I think that would be the advice that I would give myself if I had to talk to a younger version of myself, is pick projects that are the most meaningful for you. People who are very passionate and energetic, we always want to change the world, and it's easy to take on so many things that it takes over your life. But if we pick the things that are meaningful, do them well, take time to enjoy and relax in life. Don't do things just because people expect them of you. And then learning how to say no. All of these skills really help me in this very busy journey I'm on.
Nice. So they kind of complement so
Absolutely. Yeah. No, what I learn in my during the day, I can apply to some of my discussions with investors and my partner. I can apply that in the discussions that I have at nighttime.
Nice. So the mindset of a healthcare professional is completely different from that of an entrepreneur, right? So what is like the key differences that you take from being a healthcare professional and being an entrepreneur?
Well, I think it's really for me, it's the same mindset. For me, I'm a problem solver at heart, and I think a lot of physicians are that way. We have problems in front of us, we figure out solutions, and as doctors, we do have creative ideas and ways to solve problems. It's just knowing exactly what to do with those ideas and how to get those ideas out of your head, how to distill them into an idea, and how to actually turn that into something that could possibly get on the market. I mean, for NovoPlexus, our perspective, our mindset was really wanting to level the playing field so that patients can have the same exact power as large insurance companies. And also, our size, I think, is an advantage. People say, well, you're such a small company. How can such a small company make any make any difference in the world, but we think it actually gives us an advantage over some of these mega companies like Amazon, Google, and Apple, who are all playing a role in healthcare now. They want to move the power pretty much into their corner, right? Not distribute it to individuals. But as a small company, we have the flexibility to we could be more creative, and we can also adapt more quickly to our environment. So I think my skills as a physician are great. I think physicians are born entrepreneurs.
Nice. So what would be like your ideal situation in healthcare as far as like efficiency or any problems that you see? Like what would be like the perfect healthcare situation?
Well, I think the basic problem is the imbalance of power. How most of the power is being held by just a handful of groups of payers and large healthcare systems. I think if we can level the playing field so that power is distributed and patients, a lot of the power is given back to the users of the healthcare system, the patients, and even the physicians. We're pretty powerless in this whole system as well. So if you can balance the power, I think a lot of the issues with finance and supply chain and all the other problems that flow from that, I think a lot of those will get corrected once you establish a level playing field.
Ah, nice. Okay. So we're nearing towards the end of the podcast, and what I like to do is finish off with more fun exercise, the rapid fire round. So I'll ask you a couple questions, and that's not really related to healthcare, but
okay, I'll relate them back to healthcare anyway. So
okay, just see where it goes. But
we'll
first question: what is your favorite book of all time?
Favorite book? Well, when anybody asks me that, I always say it's the book I'm reading right now, which is the biography of Thomas Jefferson, who I actually found out recently that I was related to. But I'm a junkie for medical science fiction. I love Robin Cook, Michael Crichton, Stephen King, Carl Sagan. I'm a huge fan of his, and I think my favorite book is his book Cosmos. Just amazing the way he weaved science and civilization together. And I actually lived down the block from him when I was an undergrad at Cornell. He lived not too far away from me. His house was a lot larger than mine, of course, like carved into the side of a mountain in the gorge. So I think that the Cosmos would probably be my favorite book.
Okay. Yeah, I've heard of the show, but never the book.
It was based on the show, right? It's 13 chapters, each one related to the show.
Okay. So what is one goal that you want to accomplish this year?
Well, definitely want to finish up our seed round of financing and get our app into beta testing. There's not too much left to go on the round. And like I said, I think once people see what this can do, it's going to be really fun to do, real game changer, and they're not going to believe they can get the information that they can get from this.
Nice. And you kind of touched on this last question earlier in the interview, but what is one piece of advice that you could give to your 20-year-old self?
Yeah, like I said, pick things that are meaningful for you, and really try to avoid that multitasking, doing lots of things just to stay busy. When I started out in medicine, I accepted every project that was given to me just because I was so afraid of not doing enough. But then sometimes it gets to the point where you actually do too many things and you lose focus on the things that have the most value for you. So really pick the projects. Don't be afraid to say no to people. And those projects that you do pick, do them as best as you can. Do the best job, and everything will follow well if you just follow your heart and do what has meaning for you.
Awesome. I think that's a great perfect answer to end this podcast.
Yes, I think so.
So yeah, before we actually end, where can people find you? Where can people look you up at?
Well, you can find me I'm on LinkedIn. You can always find me at Weill Cornell Medical College on the Upper East Side, where I'm doing ENT. And you can find me at the websites for NovoPlexus, NovoPlexus.com. I'm there. But LinkedIn is probably the best place to find me. Just shoot me a message, and I'd love to hear from you all.
Awesome. So that concludes today's episode of the Health Tech Hustle podcast with Mr. Bill Reisacher. He shared what he's doing over at NovoPlexus and also gave us a background of his medical side. And first off, I just want to wish you good luck on getting that last seed round of financing. And I just want to thank you for joining me on this podcast.
Thank you, Rodney. It was a pleasure. Thanks for having me on.
No problem.
Thanks for listening to today's episode of Health Tech Hustle with Rodney Hu. founder of 209 Digital. Tune in next week for another interview with an expert leader in digital health.